Hey everybody, I am Ashley Price. I'm a student nurse at the University of Charleston, and I am here today to talk to you guys about intramuscular injections and a little bit about the COVID-19 vaccine. So, can anybody here tell me what they think an intramuscular injection might be?
Is that a shot?
Yes, it is a shot. It's actually a technique used to deliver medication deep into your muscles. And the reason for that is because there's more vascularity in your muscles, so the medication can absorb a lot faster. So now we're going to talk about the advantages and the disadvantages of an IM injection. So first of all, advantages. They have a quick absorption rate. So what that means is when the medicine is injected into your muscle, then it's going to absorb into your body pretty quickly. It also has the efficacy and potency of the intravenous route, so you're going to be able to get your medicine absorbed into your body a lot quicker also, whereas if you just decided to take something orally or have a subcutaneous injection. The disadvantages: onset and duration is not adjustable. So what goes in is what goes in, it can't be changed. Cellulitis at the injection site. You want to make sure you monitor the site that you had the injection. Watch for redness, swelling, anything like that. You want to make sure that you're not going to have some sort of reaction, and you want to keep a close watch on that also. Okay, some medicines now that are given as IM injections. Your antibiotics such as Rocephin, Lincocin, steroids like Kenalog, Decadron, and also your testosterone, and of course your typical vaccine is given intramuscularly as well. So does anybody remember when they were little kids and they had to go to the doctor's office and get shots?
Yeah, we remember.
Areas that you can have an intramuscular injection are your deltoid, and that's just a poor drawing of an arm there that I tried to give you an example of. It's typically given right around there. Vastus lateralis is where these little children have to go to their pediatrician, and I'm sure all the moms have PTSD whenever they see this little area, because that's where most of their vaccines are typically given. And lastly, the dorsogluteal, which is the top of the buttock, and that's where a lot of like your antibiotics and steroids are typically given. So, anybody know what the COVID-19 virus is?
COVID-19 is a type of sickness.
You are right. It's a type of sickness, and a COVID-19 vaccine is an mRNA vaccine that's used to build protection against the COVID-19 virus. So what that virus is going to do is build antibodies in our system to help us fight the virus. It's going to contain like memory cells of like T lymphocytes and B lymphocytes, and those memory cells are going to remember how to fight the virus off. It's going to prevent us from getting it, and it's also going to help us have a milder case if we were to contract it. Currently, there are 3 different types of vaccines for COVID-19. There's Moderna, there's Pfizer, both of which that have to be stored a certain temperature, and they are both coming in 2 separate injections. Johnson & Johnson, however, I don't think there's any specific qualifications as to how it's stored. However, that is just 1 injection, so that is a lot less complicated. These vaccines, they're safe and effective. There are some normal side effects like flu-like symptoms, that kind of thing. But all in all, in 2 weeks, you can be fully vaccinated, and you can start, hopefully we can get back to some normalcy. So does anybody have any questions at all?
No!
All right then. Well, thank you guys so much for joining me today while I explain these topics. So hopefully you guys got a little bit out of it and can maybe use it to make your decision to get the vaccine. So thank you.